For the next two reports, for the occurrences, I'm going to define this particular term. So what is an occurrence? This is a definition that's provided in the CDIS documentation. But the simplest way of thinking of an occurrence is just it's something that happens. It could be an adverse event. It could be a medical history term. An occurrence could be whether or not the patient took a particular medication. So we can think of all of these things as occurrences. And, oftentimes we'll look to see whether or not patients experience a particular occurrence versus that they don't. So we've already talked about adverse events in the previous recurrence analysis, and we can think of adverse events as something that occurs versus them not occurring. But this is a pretty general way of us to think about the different types of data that may happen spontaneously over the trial. So patients often don't necessarily plan on being prescribed certain medications, or they don't necessarily think that death is going to occur, or whether or not they have an abnormal lab test. But we can think about these things in this very general way, and at least for JMP Clinical 19, we're thinking about occurrences as AEs, concomitant medications, and deaths as being occurrences. And why is this important? Well, we want to look at the overlap of these particular occurrences in our analyses. And in the past, when we think about things co-occurring together, we often take a very simplistic view as to whether or not things co-occur within a patient. So here we have a Venn diagram of 5 different adverse events, and we may say, oh, this Venn diagram is showing the co-occurrence of adverse events that are happening within a patient. Well, that's true to a certain degree. We are assessing co-occurrence in a way through looking at a Venn diagram like this, but we're not really assessing whether or not that headache and the dizziness are occurring at the same point in time with one another, or whether the nausea and the dizziness are occurring at the same time as one another. And that's a level of detail that we really haven't explored very thoroughly in clinical trials. Often we just take a simple approach to say, oh, the patients had nausea and headache, without really assessing if those things are happening at the same time. And if they are happening at the same time, that sort of changes our assessment of safety. So if a patient has a headache and nausea at the same time, maybe that's more of a migraine. But if a patient has nausea at the beginning of the trial and headache at the end of the trial, those two things are unrelated to each other, likely. So the FDA OCMQs, there's a couple algorithmic SMQs, and these look at strict overlap of the data to ensure that they're occurring within a certain temporal overlap with one another. So to that end, the co-occurrence platform is examining the frequencies for pairs of occurrences that happen simultaneously within a patient. And what do we mean by simultaneously? That they're occurring on the same day. So patients may have 2 medications. How likely are they to occur on the same day with each other? Or how likely are the medications and adverse events? How much time are they overlapping with each other? So the co-occurrence platform obtains an estimate of the number of days of overlaps for pairs of occurrences to happen together. So this is adverse events, medications, and deaths. And it will summarize these by treatment so we can get a sense of whether there is some impact of treatment on the likelihood of these things happening together. So here we have an upset plot, and this is an alternate way of summarizing information together compared to a Venn diagram, but I'll walk through this very quickly. So on the bottom left, we have occurrences listed. These are different medications or adverse events that a patient may experience. And the bar chart on the right-hand side at the bottom is showing the frequency of certain events happening individually. So there's 55 outcomes of pruritus, 50 of application site pruritus, and so forth. The bar chart that's sort of in the middle of the plot are the combinations, the frequency of different combinations that are arising. So in the first column, we have 19 individuals who have pruritus and cortisone that are taken together with at least 1 day of overlap with each other. And you can see that there's a number of different pairs that are connected by the points and the lines showing different adverse events and medications that are being paired off together in this analysis. So we can think of these as little subgroups of patients that are experiencing things together. But you can see that out of the 55 pruritus cases and the 29 instances of cortisone, there's 19 instances where those are occurring on the same day with each other. And based on the proportion of treatment in the stacked bar chart above, for that first example, roughly 2/3 of those are happening in the high dose, with 1/3 happening in the low dose, and a very small 5% happening within placebo. So this pruritus issue is looking very much like a issue with the active doses, and we do have cortisone being used to treat them simultaneously. The nice thing, or the thing that I really like about upset plots, are that they are very easy to customize and modify in slightly different ways. So this particular version of the upset plot is splitting out the summaries where I'm looking at the overall summaries. I'm splitting those out into the individual treatments to get the frequencies of the values of the combinations, as well as the frequencies across all of the patients on the right-hand side. I can also modify the upset plot to use a box plot on the top where I'm summarizing the number of days of overlap of the treatments to get a sense of what's the distribution of the number of days these things are occurring simultaneously with each other. Or I can use different kinds of confidence intervals to summarize that information. So here I'm looking at the range from the minimum amount of time to the maximum, where the dots are the median values. Or I could use the interquartile range to summarize, where the majority of the data are in terms of the amount of overlap of these endpoints with one another. And in a tabular format, I can look at the pairs of adverse events and medications and get a clear sense of the number of times these are overlapping with each other, as well as the amount of time they're overlapping together in time as well. So the co-occurrence platform, this is the upset plot where I'm showing the individual occurrences, and these are the pairs of occurrences that are happening across time. So we can look at the filter and see that, I've left it to 8. So it's including occurrences that have shown up at least 8 times, but I can take this down, and JMP Clinical is essentially computing all of the overlaps, even down to a single overlap in the analysis. And of course, I can't focus on all of those particular overlaps, but I can certainly focus on the ones that are occurring quite a bit. And I can see that across all of these overlaps, a lot of them having to do with itching and the subsequent treatments of those itching, values, I can see that a lot of those are being done within the high doses of these particular treatments. And as far as modifying this plot, it's as simple as clicking this range bar. So here I'm understanding the proportion of these overlaps, how they occur within the different treatments. But here I'm getting summaries of the number of days of overlaps, whether it's a box plot or a range bar or an interquartile range bar. You can see here that for the two instances of the high doses that we have these confidence intervals here, but the median amount of overlap for itching is actually highest on some placebo patients. So even though there's fewer instances of itching with cortisone treatment, the duration for the placebo patients that are experiencing is actually quite a bit longer, which is an interesting tidbit. And again, we can modify to break things out by treatment by clicking the frequencies by treatment value. So again, I'm looking at the dictionary derived terms. So the preferred terms, I'm looking at the coded medication terms, but I also don't have to look at this particular level of granularity. If it was of interest to look at classes of adverse events or classes of medications, I could assess the overlap of the classes with one another by modifying this analysis and rerunning it. We have a tabular display for people who are interested in the details of the numbers and want explicit values compared to the graphical output.